I want to keep the baby submerged in the tub for longer than 5 minutes. We're going to take our first washcloth, no soap. We're going to wet an edge of it with our finger. We're going to clean one eye from the inside corner to the outside corner. Change our area on our cloth. Do the other eye from the inside to the outside corner. And then we're going to use the rest of the cloth to wipe down the baby's face. No soap ever on the face. We're going to take our finger into one area and we're going to clean the ear. Nothing bigger than our finger in the ear. Never any Q-tips or anything like that on the baby. Clean inside the ear and out and behind on both sides. Now with two students, one would be doing the holding while the other is doing the washing. You have to remember that the dads want to videotape this first baby bath. You also want to include the siblings. If there's any smaller children, have them push up to the tub in a chair so that they can help. I usually have them just swish water around by the feet of the baby. Try and keep them away from the head of the baby. We are not going to worry about the hair at this point in our procedure. Now we can use soap. You can put soap right onto baby's chest, or you can get, I put that face cloth aside, you can take your next face cloth, get it wet, put soap directly on your face cloth, and now we're going to proceed from clean to dirty, so chest down to feet. You're going to make sure that you get into the creases of the neck. That's where a lot of vernix lays. Now if your baby has a lot of vernix, you don't want to rub really hard to get it out. It can irritate the skin. Vernix is kind of Mother Nature's cold cream, so we're not overly aggressive in trying to get it out of the creases, but we do want to get as much off as possible. The fingers in the armpits, the chest, be careful going around the cord, do the front of the legs and the feet. Then we're going to take our baby, we're going to make a C around the baby's chin and sit the baby forward in our hand. Use your cloth to then clean the back of the baby. Lay your baby back down. Rinse your baby off. Then with the same grip, so under the shoulders, grip the far arm. Under the near leg, grip the far leg. Pick your baby up. Bring your baby over. Lay your baby down on the towel. And you're going to wrap your baby up. Keep your baby warm. Depends on how big your towel is. One student is going to pick the baby up under the arm in the football hold. And with one finger, you're going to close one ear forward. With your thumb, you close the other ear forward to keep water out of the baby's ears. Use the water that's in your tub to wet your baby's hair down. Apply shampoo or your soap. Get a good lather. You cannot hurt the baby's head for this fontanelle. If your baby has molding or a cephalohematoma, just gently rub over that area because it is sensitive to the baby. You have to make sure you get way in the back. There's always a lot of debris in the back of the neck. You can take your scrub brush if you have a lot of vernix and gently scrub the baby's head. Or if you don't have a scrub brush, you can take your baby comb and comb completely through the baby's hair. Now we put water in our pitcher or our bowl. We're going to use this water to rinse the shampoo out. So you're gently going to pour the water while you're holding the ears shut and rinse out all the soap from the baby's head. Then we're going to take our baby and we're going to move the baby over to our warmer. Move our t-shirt out of the way. And we're going to dry the baby thoroughly, making sure we get all the crevices behind the knees, in the legs, around the genitalia, the armpits, all the fingers. Then take our towel and gently massage and dry the hair. Now our baby is going to stay on the warmer for a little bit, so we want to get all the wet towels out from under the baby. Otherwise our convection will not work correctly. And we're going to attach our probe to maintain our baby's temperature onto our baby. And it goes silver side down, right next to the cord, and we put our little sticker over. Some facilities have little hearts, others have little teddy bears. And this is going to regulate our temperature. Now we can go ahead and put our diaper on so we don't have any accidents, but no clothes. At this point, the baby needs to stay completely uncovered so our heating element works correctly. So we can take our diaper and we can put our diaper on. I like to put it over the cord first, apply my tabs, make sure you put it on good and tight, and then fold it down under your cord. Now this device regulates the baby or monitors the baby's temperature, but it is not 100% accurate. So we give the baby about 10-15 minutes, and then we're going to take another temperature to make sure that the baby is able to be dressed at this point. The baby's temperature needs to revert back to above 37.0 before we can bring the baby off the warmer, dress the baby, and give it back to mom. While you're doing your bath, you can answer and do all your bath teaching with mom. Babies can be submerged in tubs as soon as they get home. They don't need to wait until their cord falls off. The cord can get wet. Babies also don't need a bath every day. Most babies only need a sponge bath around the face, in the neck folds, and the hands. The diaper area every time you do a diaper change, and a full bath only once a week until the baby can really enjoy the bathtub. Then you can up the amount of times that the baby has a bath. The room should always be warmer than what we feel it should be. We should be comfortable in a sleeveless shirt to give the baby a bath at home in our kitchen or in our kitchen sink. There should be no open or drafty areas, and babies should be immediately wrapped up and dressed as soon as the bath is over. Now, our baby still is brand new, has trouble maintaining its temperature, but we do not want to put our hat back on until our baby's hair is completely dry. So the baby may come off the warmer, have its t-shirt on, be wrapped back up in its blanket, but its hair not completely dry yet. So we don't want to put the hat on and cause more moisture or problems with the baby's temperature. And that